My fellow specialist physicians, do you find yourself frustrated as you need to spend less time with patients and more time in writing notes, coding, and billing? Do you find frustrated of being blamed by patients for the current issues in the traditional medical system? Do you feel frustrated to spend more time dealing with insurance companies as your value and your expertise is not paid appropriately, or the services that you rendered are denied, or even clinical judgment is questioned? Do you feel frustrated to see that you don't have time for your own family or for yourself? Are you considering leaving medicine and finding other ways to support your family? I am here to tell you that there is a way to practice what you work for many years and what you love the most, what you love to do, medicine, in your own terms. This is called direct specialty care. Hello everyone, I'm Dr. Diana Gurnita. I'm a board-certified rheumatologist practicing direct care rheumatology. In 2020, I transitioned into private practice and founded one of the first direct specialty care rheumatology practices in the United States. Since I transitioned, I quickly understood the benefits of practicing direct care. I worked on developing my practice, and I started to advocate for these alternative ways of practicing medicine. I am humbled to say I have empowered and inspired many other specialists to begin similar journeys in developing direct specialty care practices. As physicians, our goal is to improve the lives of our patients. This is what I love most about being a doctor, seeing my patients recover and become themselves again without having to spend months in pain, waiting to be seen, and going into debt because of copayments and many surprise bills. To my fellow physicians, I know many of you in private practice think about merging with the big systems to overcome the hurdle of seeing more and more patients and cutting the expenses that you have today to support your practice. My fellows, I know some of you are thinking to leave medicine altogether, like many other amazing physicians that I know have left medicine altogether. The good news is that we can overcome this. The patient-physician relationship we once considered a fairy tale can be restored by opening a direct specialty care practice, a practice that will contract directly with patients. What is direct specialty care? Direct care is the practice of old-fashioned medicine, where the doctor and the patient have a direct relationship. This way, patients contract directly with physicians. Patients have the advantage of not needing a referral to see you as a specialist. It is simple. Patients call, make an appointment with a specialist when they need it the most. There are not waiting times, endless waiting times, and there is not interference between the patient and the physician. The patients come in, they are examined, you can perform diagnostic tests, and then you can offer them treatment. The payment of the service is made directly to the doctor's office. It is that easy. However, patients do not know that they have options. Patients need education. It is our role to teach them that they have options. Most of our patients, when they think about healthcare, they think about the today's traditional medical system. This comes to no surprise, as most of these people, that's what they have experienced. That's how they grew up with. Take the time to explain to patients that medical care and healthcare insurance are not equal. Sadly, carrying an insurance card does not guarantee the medical care that they need when they need it the most. Actually, most of the patients that come to my clinic, in my rheumatology clinic, my direct care rheumatology clinic, they do carry health insurance, but when they need to use it, they don't have access, or the access that they get comes many months too late. What is direct specialty care? Direct specialty care removes all the middlemen between patients and physicians. Without the interference of insurance companies, you can offer these patients your expertise again when they need it. In direct specialty care model, you can and you should put the patient first. Offer transparent pricing. Be accountable to your patients as they are accountable to you. And educate patients that they have options, and educate patients that you are there to serve them. And in this way, you will regain your autonomy as physician. The Direct Specialty Care Alliance. Direct specialty care is the solution if you want to restore autonomy and practice medicine again. This is why we created the Direct Specialty Care Alliance. Direct Specialty Care Alliance is an organization that will lead the movement of specialist physicians in becoming independent and providing direct care services to patients. We provide specialists vision, leadership, and guidance through physician-led education, mentorship, and advocacy. Our goal is to see more independent, physician-led practices that thrive to partner with their patients to provide the highest quality care for an accessible and transparent cost. Our dream is already coming true, as we have inspired and helped many physicians to join direct specialty care. I invite you to read my latest article in Kevin and Dee to learn about the steps that you need to take to understand and start your direct care practice. I will link the article below. Direct specialty care physicians thrive in their practices and provide old-fashioned medical care. These physicians regain their autonomy. They can help thousands of patients. They can have time for their family and enjoy practicing what they know and love the most, medicine. Join us in creating this network of physicians available today to serve our patients. You will be visible to one another, and you will be visible to other physicians practicing direct care. You will be visible to patients that are ready to take their health in their hands and decide what is best for them today. Once again, you are not alone. The future of healthcare is in our hands.